Okay, I'm Gail Keller. I'm going to be performing catheter care for Mr. Jazz here. Before entering the patient's room, I'm going to check if it's the right patient and then the right procedure being done. I'm going to be checking what catheter is being used and what size is being used. And why it's being used. So currently Mr. Jazz he has acute urinary retention as well as strict immobilization, which requires both our requirements for a catheter, good requirements for a catheter. I am going to collect my materials while outside of the room. I'm checking for expiration date as well as any rips or tears, none of which I see. I'm grabbing gloves and double checking that catheter is the right procedure we're doing. Okay, entering the patient's room. Hello, Mr. Jazz. I'm Gail, your nurse today. Can you confirm your date of birth and your name for me? Mr. Jazz, 7/15/1940. Do you have any allergies, including any latex allergies? No? No known allergies? All right. Perfect. I'm going to educate him now on what a catheter is and why it is used. Due to your immobilization, it's going to make you a lot more comfortable, okay? If we're going to administer a catheter for you, okay? So before I perform sterile technique, I am going to provide privacy, which is right here for him. I'm going to perform hand hygiene and glove, and then I will be exposing him. I'm going to be exposing you here, sir. Placing a towel beneath him, and I'm going to be performing pericare. After pericare, I'm going to then assess his genitalia, make sure that there's no lesions or scars, or his skin integrity is all intact. I'm then going to remove my gloves, remove the towel, wash my hand hygiene once again, and then I'm going to move on to my sterile technique for the catheter. Okay. So again, I'm going to assess my bag, make sure that I have all my materials and that there's no tears in my kit. I'm going to remove my kit from the bag here. Okay. That flap is still up. I'm going to form this into a trash bag. And then I'm going to position your knees so that they're a little up. For number 10, you have really good knees. Okay, this was up. All right, now I'm going to be taking my sterile field, opening it towards me, to the sides, only touching the edges, and then away from me. I'm going to turn this. Taking the sterile blanket field thing, blue thing, this is all sterile. So I'm only going to be touching the sides. I'm going to place this in between your legs, Mr. Jazz. Okay. And then now I'm going to be moving on to my gloves. I'm going to be taking my gloves here. I'm opening up my gloves here. I hope you can see that. With my non-dominant hand, I'm going to place my dominant hand in my glove. Nice. With my other hand, I'm going to be, okay? placing that in garbage. Now I can touch my sterile field. And I have the swabs right here. The jelly as well. Okay, I'm placing my swabs in here. I'm putting the lubricant on the side. I'm opening my catheter bag, or my catheter little doohickey here. Turning that away. Alright, now I'm moving my container to the sterile field. Okay. I'm now going to, I've already done pericure, so I'm now going to take the sterile thingamabobs and do a circular motion, using only one at a time with each stroke. This is now on sterile glove on my left hand. Okay. I'm going to lubricate the catheter now. And we're going to insert the catheter now, Mr. Jones. You're going to feel a little bit of pressure. And I'm inserting, not touching the penis with my glove yet. We go a lot slower than this, hopefully. Once urine starts to come through, I will continue on for males to go all the way through with the tubing. Alright, now I'm going to take my syringe. Holding the catheter in place. I'm not going to drop that. Holding the catheter in place, I'm going to connect the syringe. Inflate the balloon. Taking note of how much I'm administering. 10 milligrams. If he will go for me. There we go. Taking it out before it fills up again. And tugging on it to make sure it's completely inflated. I'm now going to attach the catheter to his thigh. Remove. Oh, there we go. It's attached here. I'm going to remove all my sterile things per facility policy. Roll it that way. I would then take the urinary bag and I'm going to place it underneath him so that the flow of the urine can flow down with gravity. This is attached to his thigh. And then I'm going to remove my gloves. I'm going to cover you up here, Mr. Jazz. Give you your call light. And then ask if he needs anything else. Come in frequently to check his urine input and output. I'm going to then document what I just did, the size of the catheter, how much liquid we inserted into the tube, the sterile tube, and then look at the color of his urine, as well as assess for any unusual color drainage. I think that's all. So we document, yes. And then I'm going to leave, and when I come back, I'm going to gather all my supplies again. This includes not non-sterile gloves. Yeah. Make sure it's the right patient and make sure that I'm supposed to be removing the catheter. Hello, Mr. Jazz. I'm going to be removing your catheter today, okay? Can you confirm your name and date of birth for me? Checking 7/15/1940. And are you allergic to anything? Latex? No latex, no allergies. Perfect. All right, now I'm going to remove your catheter today, okay? So I'm providing privacy again. And then I'm going to perform hand hygiene. I performed hand hygiene before I left the patient's room the first time. Hand hygiene, I'm gonna put gloves on. I should probably do that. Okay. Alright, once I have gloved, I have water and soap, which I'm going to wash him with afterwards. I would have, I don't remember if I did, but I would have provided perineal care before getting all of the orange stuff off and all of the lubricant off before I left him. Okay. And then I will place a blanket underneath to make sure nothing spills. Alright, and then I'm going to de-inflate my balloon here. Hopefully. I don't know if this is going to disinflate. It didn't for me. Mine's a little broken. Okay. Well, it did disinflate. And I removed the catheter. Prior to removing the catheter, I removed the output from his urine bag. And I measured it before throwing it away. Then I removed this after. Alright, and then I will okay, so I've disposed of this per facility policy. And then, wow, we're really struggling here. Okay. So it's not coming out. That's a problem. Anyhow, so yeah, I got it out. And then now I am, oh, there we go. There we go. It's working. It's working. Sorry. There. Alright. Sorry, Mr. Jones. Now I'm disposing of it after I've collected his urine input. I'm going to check for any any lesions to his skin integrity. I'm then going to provide perineal care, assess his genitals, remove gloves. Now I'm going to document what I just did, which was to remove Mr. Jazz's catheter. And noting how much urine he put out, what color the urine was, what the size of the catheter was, what kind of catheter it was that I was taking out, his name, of course, my name, and any other documentation that I would need. Then I give him his call light, ask him to tell me if anything goes wrong, and educate him on how to care for himself without the catheter now. Hand hygiene. I did that after my gloves. And that's catheter care. Thank you.